What if I told you that the secret to maintaining razor-sharp physical balance, absolute structural independence, and remarkably strong legs well into your 70s, 80s, and beyond does not belong to a modern fitness laboratory, heavy weightlifting machines, or complex physical therapy clinics? Instead, what if the true mechanical answer resides in the ancient, low-impact, purposeful movement cultures of Japan, where older adults consistently maintain the ability to walk completely upright, rise effortlessly from the floor, and remain free from the fear of falling long after celebrating their 75th birthday? For many older adults across the Western world, crossing the milestone of age 70 marks a quiet, frustrating transition. It begins almost imperceptibly. You notice that standing up from a deep, plush living room chair requires you to push off heavily with your hands or rock your torso back and forth multiple times just to build momentum. You notice your steps becoming slightly flatter, turning into a subtle, dangerous shuffle where your toes skim perilously close to the edge of living room rugs, concrete sidewalk cracks, or bathroom thresholds. Most seniors brush these early warning signs off, assuming that leg weakness and unsteadiness are simply the unavoidable taxes of getting older. They accept the narrative that their muscles are just too old to improve, so they sit more, move less, and slowly watch their world shrink. But as a physician, I want to challenge that misconception with absolute clinical evidence. In restorative medicine, we look closely at Japan, home to some of the highest concentrations of centenarians and active seniors on Earth. Eastern movement philosophies do not focus on exhausting your body or pushing your joints until they throb with pain. They focus on something entirely different: mindful joint articulation, deep pelvic alignment, and retraining the brain-to-foot neural pathway. Today, I am going to pull back the curtain on 5 simple, doctor-approved, Japanese-inspired exercises you can perform safely at home using nothing but a kitchen chair or a countertop. These movements are specifically engineered to reactivate your deep stabilizers, strengthen your thigh mechanics, wake up your lower legs, and restore the absolute balance confidence you need to live life entirely on your own terms. Before we uncover our very first longevity drill, if you want to shield your physical freedom, protect your lower body, and defend your independent mobility as you age, please click that subscribe button below and turn on the notification bell so you never miss another senior health blueprint here on the Dr. Robert channel. If you are ready to flush out lower body stiffness and rebuild your balance foundation with me today, please type 1 in the comment section right now. If not, drop a 0 so I can learn how to optimize these medical blueprints for your personal goals. Let's analyze the precise anatomical decay that happens after age 70. Human movement relies on a vital biological map known as proprioception. This is a massive grid of microscopic neurological receptors embedded deep inside your foot soles, ankle tendons, and hip joints. Their exact job is to tell your brain precisely where your weight is shifting relative to gravity. In traditional Japanese lifestyle habits, 2 major differences keep these receptors alive. 1. The floor-to-chair baseline. Historically, Eastern cultures spend centuries transitioning from the floor to standing, which constantly exercises the hips and thighs through a massive range of motion. 2. Sensory foot contact. Walking indoors in thin socks or barefoot on textured tatami mats constantly stimulates the tactile nerves on the bottom of the feet. Conversely, modern lifestyles trap senior feet inside highly cushioned, thick-soled shoes and hours of sitting in deeply sunken, soft recliners. This creates a state of sensory blindness. Your feet stop communicating with your brain. Because your brain can no longer feel the floor clearly, it defaults to a protective reflex. It shortens your stride, stiffens your knees, and causes your hips to sway uncontrollably side to side. To reverse this tracking error, we must implement focused, high-yield movements that reactivate your lateral hip stabilizers, specifically the gluteus medius, and strengthen your lower shins to ensure proper foot clearance. Let's break down the 5-move Japanese longevity reset you can practice safely in less than 10 minutes a day. Movement 1. The Asa Morning Anchor Rise, Seated to Standing Reset. In Japan, The transition of rising with complete center control is treated with immense respect. This movement eliminates the habit of rocking or jerking your body upward, directly isolating your quadriceps and glutes. How to do it? Sit near the front third of a sturdy dining chair. Avoid soft, rolling chairs. Place both feet flat on the floor, perfectly parallel and hip-width apart. Before you move, pause for 2 full seconds to mentally push your weight through your heels. The execution: hinge slightly forward from your hips, bringing your nose over your toes, to mechanically shift your center of gravity. Pressing firmly through your midfoot, stand up slowly over a 4-second count. Do not rush. Once fully upright, squeeze your glutes and stay perfectly frozen for 2 seconds. Now, take 4 slow seconds to lower your hips back down, touching the seat as softly as a feather. Complete 8 to 10 meticulous repetitions to construct deep thigh strength. Movement 2. The tatami toe grip and shin overdrive. This drill mimics the natural foot-strengthening dynamics of walking barefoot on textured mats, specifically targeting the front shins to eliminate a lazy shuffle. How to do it? Remain seated tall at the edge of your chair. Place a small hand towel flat on the floor in front of you. Rest your right foot on the fabric with your heel planted firmly. The execution: spread all 10 toes wide, then curl them inward forcefully to grab and scrunch the towel toward your body. Complete 12 scrunches per foot. If you are practicing on a thick carpet where a towel won't glide, execute the raw version. Keep your heels down, pull your toes and the balls of your feet up toward your shins as high as possible. Hold for 2 seconds, then curl them tightly downward into the floor for 2 seconds. Repeat this loop for 60 seconds per side to instantly increase blood flow to your peripheral nerves. Movement 3. The countertop bamboo heel raise. Bamboo is celebrated for being incredibly strong yet immensely flexible. This movement builds profound ankle stability and conditions your calf muscle pump, your second heart, to pump pooled fluid back up to your chest. How to do it? Stand tall behind your kitchen counter or a heavy table, placing both hands flat on the surface for absolute balance security. Keep your torso long and your eyes fixed forward on the horizon. The execution: slowly elevate both heels off the floor, rising onto the balls of your feet as high as comfortably possible without forcing your joint boundaries. Pause at the absolute peak for 2 full seconds to challenge your balance architecture. Then take 3 slow seconds to lower your heels back to the ground. Controlled lowering is what conditions your nervous system to handle your body weight safely during a stumble. Perform 2 sets of 12 repetitions. Movement 4. The Torii Gait Sidestep Sweep. Named after the balanced, structural pillars seen across Japan, this drill targets your lateral hip stabilizers, ensuring your pelvis stays rock solid when life forces you to turn quickly or step sideways. How to do it? Face your kitchen counter or a clear wall, placing your hands lightly on the surface for protection. Keep your toes pointing straight ahead and soften your knees slightly. The execution: take 1 slow, deliberate step to the right, about 8 to 12 inches. Do not let your body sway or tilt to the side. Keep your shoulders perfectly level. Once your right foot lands, slowly draw your left foot over until they are hip-width apart again, pausing for 1 full second. Take 5 controlled steps to the right, then track 5 steps back to the left. Complete 2 full rounds, making sure to actively lift your feet rather than dragging your slippers across the floor. Movement 5. The Suru Controlled Balance March. This final advanced drill explicitly trains single-leg dynamic stability, preparing your lower body for real-world scenarios where 1 foot is suspended in the air. How to do it? Stand sideways next to your counter or a solid hallway wall, keeping 1 hand securely anchored to the surface as your dedicated safety button. The execution: stand tall, brace your abdominal wall softly, and slowly lift your right knee 2 to 4 inches clean off the ground. Hold that foot suspended in mid-air for 2 full seconds while keeping your standing leg steady and your gaze forward. Lower the foot back down silently with total grace. Alternate to your left leg. Complete 10 slow, deliberate marches per side. If your body begins to lean or wobble, simply make the knee lift smaller. Even a half-inch off the ground triggers the vital stabilization pathway. Combining these 5 Japanese-inspired exercises into a cohesive weekly habit requires less than 8 minutes of your day. You can perform your anchor rises right before breakfast, complete your heel raises while waiting for your morning coffee to brew, or practice your balance marches during an afternoon television commercial break. Let's discuss your physical preservation with absolute transparency and direct medical honesty. These home movements are specifically designed to reverse muscle quietness, decompress tight joints, and accelerate neural feedback. They are an exceptional form of structural protection, but they do not replace direct, professional clinical care if you are managing severe orthopedic or neurological conditions. True fall defense and longevity require smart, calculated daily adjustments within your home environment. The lighting grid. Ensure your hallways and bathrooms are fully equipped with automatic, low-profile nightlights, as your vision plays a massive role in calibrating your balance in the dark. Path clearing. Completely eliminate or tape down loose decorative throw rugs, clear away low cords, and keep walking paths clear of clutter. Footwear awareness. Avoid walking around the house in loose, backless slippers or thick socks on slick hardwood or tile floors, which act as major slipping hazards. Opt for secure, non-slip footwear instead. The 5-second transition rule. Never sprint out of bed or a deep chair the split second you wake up. Always sit completely upright for 5 seconds to allow your blood pressure to normalize before taking your first steps. Doctor's essential safety alert. If you ever experience sudden lightheadedness, sharp joint friction, localized chest pressure, or a sudden painful swelling in a single calf muscle, stop exercising immediately. Rest, allow your system to settle, and seek professional clinical evaluation right away. Your physical independence over the next decade is not dictated by your calendar age alone. It is shaped entirely by the small, repeatable physical choices you make within the comfort of your own home. By taking less than 10 minutes a day to anchor your stance, pump your ankles, and stabilize your lateral hips, you are giving your body the vital structural preparation it needs to protect your freedom, your dignity, and your lifestyle. Please take a brief moment right now to comment below with your current age and share which of these 5 longevity habits you are going to practice first today. Click that like button, share this clinical guide with a loved one who wants to stay rock solid on their feet, and subscribe to Dr. Robert to protect your structural health journey. Thank you so much for watching, keep your foundation aligned, and I will see you in our next video.